associate professor, assistant professor, vice principal since 2009 to till date. Also, sir worked previously at Nutan School of Nursing, Nandgaon, at the assistant lecturer in the year 2006 to 2007. Before that, sir worked at the Sarvodaya School of Nursing, Rajasthan, as a guest lecturer, clinical instructor in between 2004 to 2006. The total working experience of Dr. Mohammad Hussain sir is 16 years. About position held under the MUHS and other university, sir worked as a BOS chairman at Maharashtra University of Health Science, Nasik, also work as an academic council member, also work as a member of finance and account committee, work as a member of student welfare, BOR, Board of Research, etc. Also work as a BOS member at Malvanchal University, Rajasthan. Sir also working as a PhD guide at JJTU University, Rajasthan, currently appointed as a panel member to various universities for PhD Viva. Sir having experience as an assessor for Quality Council of India with the project under National Accreditation Board for Education and Training. Currently working as a member of Unfair Means Inquiry Committee for the year of 2023-2028 at the Maharashtra University of Health Science, Nasik. Currently appointed as a chairman committee for semester pattern syllabus implementation for BSc Nursing. About the paper publication, sir did the total 6 paper publication in the national and international journals. About the professional activity attendance, sir attended the total 32 conferences, workshop, FDP, seminar, webinar at various universities and colleges. The contribution of Maharashtra University of Health Science, Nasik is that sir is having experience as a chairman at local inspection committee in the Maharashtra University of Health Science, Nasik. Sir work as a VC nominee and member of selection committee in the various colleges under the MUHS, work as a paper setter, examiner in the various universities. Also, sir work as a center observer, center in charge, flying squad, etc. Sir work as a board of study, member of board, chairman of board of study, work as a committee head for changing the syllabus, semester pattern. Currently, sir working as a BOE, Board of Examination under MUHS Nasik. Dr. Hussain sir is highly respected expert in the nursing education with extensive experience in the quality assurance and clinical practices guidelines. His work has greatly contributed to advancing the nursing standards and enhancing the educational practices within the healthcare sector. Today, he will share his insight on the crucial topic of the quality assurance in the nursing education with clinical practices and guidelines. His expertise will provide us valuable perspectives on improving the educational practices and ensuring our nursing program meet the highest standard of excellence. Please join us, sir. Welcoming to sir on the stage. Over to you, sir. Thank you.
A very good morning to one and all. A very good morning. In a beautiful campus, in a beautiful auditorium. So, thank you so much for giving me a beautiful topic, which is according to my specialty and which is much more needed topic in this current era. So, a very much thankful to PO sir and the organizers for giving a beautiful topic. And I will try to give and fulfill the need according to the topic which is given to me. So, a beautiful need of this era, quality. So, wherever we goes, always we try to see the quality. Whatever the situation and conditions, wherever we discuss, always we require quality. Hello. Okay. So wherever we goes, when we ask something, whether any condition or situations, we require quality. Even though when we go to purchase something also, we require quality. And we always says, I wear quality, I see the quality, I use the quality. Means any product. And this is the era where everyone demands quality. So same like this in our professions where we are delivering education or clinical practices to the stakeholders require quality. And absolutely it is in their right to get a quality. So here to keep pace with the change which occurs in our day-to-day life, we have to make some changes in our professions. So same like yesterday, there was a beautiful topic, it was conducted by the I. Clement sir and Larissa Martha madam. Why there is a need of changing in the syllabus? Why there is a change is required in the clinical practices? Because we cannot keep pace with the changes which takes place in our day-to-day life. So whatever the services we are rendering since beginning, we cannot rely on that. Why? Because we are becoming advanced and advanced and advanced. So with this, there will be the quality which comes. So when the quality comes in that condition, people will follow the person and always says the quality is there. So when people will see for the admissions, always they will see the organization like this Godavari Education, Godavari Institute, where they are serving quality. When you will see this program, definitely I can say the quality is given to the delegates. And the quality is given to all the resource person in the regards of hospitality, in the regards of the delivering lectures, a beautiful auditorium and beautiful audience, I can say, the interesting students, and each and everything was a quality. So when the quality comes, always we feel some like satisfaction. So same like this is my topic where we are going to learn about the quality educations and clinical practices which we are following in our day-to-day life to satisfy and to make assure the patient like they are in a correct organizations where they are receiving the services. So what is quality? Go to back side. First slide. So what is quality? So quality means something which is satisfying. What is bad or what is good? So which will define us whether it is correct or not, whether we have to go for this or not. So it gives a purity. So how we say it is a quality product, which give a purity and satisfaction. And you will be fully satisfied that this is a good things and you can go ahead with this. So that is a quality. And same time, we'll see the assurance. Assurance means it is a promise which is given by the product or your services. Like it is 100% good, or we are assured that we are on a right organizations, we are on a right way, we will be confirmed that we will be getting a good things. That is assurance and promise which is given by the organization to the stakeholders. So here in our nursing education and clinical practices, we see our stakeholders like in the colleges, the students and then parents. What is their demand? They should be getting higher and quality educations. So after that, when they will come out from the organization, they will be getting a handsome services with the good organizations. So everyone is expecting same things. So it is our prime responsibility being a members of the organizations, whatever it is, a clinical settings or educational settings, if we are fulfilling the demand of the stakeholders, then we'll be justifying to our services. So same thing, it is a quality assurance. So being a member of the health sectors, nowadays this is the era where everything is changed. You can see the corporate hospitals where the handsome services are given to the patient and patients are happy and always they try to go where they are satisfied. So stakeholder satisfaction is a very, very important thing before go to proceed for the quality assurance. So quality always we have to see, definitely it is a right of each and everyone to see the quality. wherever we goes, we have to follow the quality. If we have a quality, quality will follow you. So same thing. So we'll proceed for the quality assurance in the nursing education. For that we do many activities, and there will be a lot of contributions from the nursing teachers, organizations, and their effort to get the quality of the organization. So definitely I can say it is a teamwork of the members of the organizations where they learn. That is also very, very important thing. Learning goes continuously till life ends. So that is required for the quality. Quality comes when we are refining the ways. It is a long-on procedures where we are refining our services, and it takes place for a longer period, and then quality comes. So it is an quality of each and every individual has a capacity to be a quality person, or quality teacher, or a quality nurse. So quality comes when we are perfect in our services, we are fully skilled in our services. So I always used to tell my students, be a skilled person. There is no need to search the job. Job will come automatically when you are skilled and qualified. So whenever you do your work, please do it with your passion. Like we have seen a Virat Kohli in a cricket. He gives 100% when he is there on the ground. So like when you are there in the field of our ground, whether it is education or it is a clinical settings, give your 100%. Definitely when we will provide 100%, it will comes to you. Like we always say in a karma, jaisa kiya वैसा भरना है. So same thing, when you will give 100%, automatically 100% will comes to you. So this is the quality which comes when we take the effort. And please take an effort, which will become a habit of you. When you will do perfectly, you will become a perfectly, and you will follow always perfection. So perfection comes when we are in a process of doing the things in a correct way. Then once if you will do correct, automatically your ways will go on the same way. Like I want perfection. So it become a habit. So quality always makes a habit of being a quality person. So quality comes when we follow the quality. So now we'll proceed for the quality assurance in a nursing education, and what are the guidelines we'll follow in a clinical settings to keep a quality in a services which will be rendered by the nursing professionals in the healthcare. How it will go, proceed. Okay, so quality assurance now is a major consideration for providers of the good and services. So for us, it is a prime job of us to provide a quality services to our stakeholders in the society, especially in the service industries of higher education and the health services. So we belong to the higher educations where there is a health sectors. So it is a prime responsibility to deliver the quality to the students. So nursing is a career that combines scientific principles and technical skills. Always when we discuss about the nursing, always we say we follow the scientific principles. So why scientific principles? Because they have some laid down procedure for the scientific principles, because it leads to a quality. So wherever there is a procedure, there is a scientific principle in the form of rational. Always we follow. Why we follow? Because we know the standard. When we deliver the services, so what will be the result? So result will be a positive. So that's why the principles which will be followed in a services where we are delivering to our stakeholders. So defining quality is difficult. But generally when we say the quality, one thing comes in mind, which will give satisfaction. So quality will be there in a form of many things. But generally when we say the quality means 100% satisfaction. Yeah, whatever the things I have received, it is satisfying me. So same thing here also. When we think about the quality in our profession, students should be satisfied. क्या लेक्चर लिया सर ने, मैडम वो बहुत अच्छा लेक्चर लेते हैं. जनरली वी यूज टू से, अगर कोई अपने को अच्छा डिलीवर करता तो ऑलवेज वी यूज टू फॉलो एंड समटाइम्स वी कॉपी ऑल्सो, लाइक सर इज डिलीवरिंग, मैडम इज डिलीवरिंग लाइक दिस, so they also follow. So quality always will be followed by some persons if they are satisfied. So same like quality is a difficult, but the expenses of quality is an interaction process between customers and providers. So like here we are the members of the healthcare institutions where the stakeholders. So what is the interactions between these? How they are getting things from the providers? So if they are 100% satisfied, then definitely they say quality has been delivered to me and I am fully satisfied. I will learn the things and I will follow the things in my professional activities and in a career. So concept of quality assurance. Quality assurance is a dynamic process through which nurses in both academic and clinical practices assume accountability. And this is a very important thing, accountability. So whatever the things we are delivering to our customers, the stakeholders, we are responsible. We are accountable. So make a habit of that you are accountable to something. So when we are delivering, means it is 100% our responsibility whether your students are getting or not. So accountability always it should be followed by the providers, and assume accountability for quality of care they provide. So this is the concept of quality where the persons those who are relating to this will be accountable to deliver the things which is required by the student. And objectives. Definitely, the quality assurance we have a objectives, why it is required. So each and everyone has a right to get a quality things. So yeah, if we see the objectives, so to provide technical assistance in designing and implementing effective strategies for the monitoring quality and correcting systemic deficiencies. So here on this is the beautiful objectives where everyone has to provide technical assistance which is there as per their professional activities which they are going to deliver to the patients and stakeholders, and then to refine existing methods for ensuring optimal quality healthcare through an applied research program. Yesterday our beautiful topic was their evidence-based practice. Nicely it was taken. So in that, why evidence-based research is required? Because we cannot rely whatever we have given services earlier to the patient. So refining is very much required. So when the quality assurance comes, we have to be refined. The services should be refined and good things we are going to provide to the stakeholders. So these are the objective of quality assurance where the quality comes, always refining, research, everything is required on the way of quality provision. Then why is quality assurance in nursing education a necessity? Definitely. What is your answer on this? What will be your answer when we think about this question? Why is quality assurance in nursing education a necessity? Whether it is required, it is necessary? Definitely, 100%. It is required. It is required of this era also, because we have to keep pace with the change which occurs in our day-to-day life. We cannot rely whatever the things we have done yesterday. Today is the new things. It will be there. So, it is necessary. The change should be there. When the research comes in that conditions, we will become a refine, and then we will be able to deliver the quality care to the patients and quality education to the student. So all over the world, nurses represent the largest group of the healthcare professionals. They are constantly in touch with all the hospital staff and they stay longest with the patients, performing their services to the patients. Definitely, we will be the persons who will be in a longer durations, will be along with the patients and delivering care to the patients. So keen observations. Definitely, quality assurance, when we think about this, very much required. So nowadays, when we will go, always there is a mechanism of a feedback. So why feedback is necessary? Because hospital comes to know, college comes to know what changes is required. So whatever the services we are giving, whether it is correct or not. So for that feedback mechanism is there. So here also you will see at the end of program, definitely it should be there. So in future, if we do something other or we are planning in that conditions, we will come out with some other good solutions. There will be a best and best technology will be used in upcoming conferences, services. That's why it is equality assurance, where this is required. Each and everyone should be satisfied. So whatever the services are there, it should be satisfying the customers and stakeholders. So quality assurance in nursing educations. The field of nursing educations is vast, where many courses are available, and there is a prime motto of this education means delivering a good educations to the nursing. So to keep pace with the good educations, the necessary correct changes which takes place from the supreme body, Indian Nursing Council, then later on which will be implemented. And fortunately, I was the chairman of the committee of the syllabus changes, which was under me only, and I learned many things, and I have been in contact with the Central Council also for this. So beautifully they have designed this, but the thing is that we have to be perfect for delivering these systems to the student, because it is new. So trial and error will be there, but we have to make some effort, we have to take some effort to implement it effectively. So why this change takes place? Because this is a need of the era, where we have to keep pace with the change which takes place in the Western countries and all. If you see the syllabus, it is very, very important and first class, if you see. Very well designed. So why it has been changed? Because we are there to serve the quality. So quality assurance will be there when we get the educations from the organization where it is there. That's why the syllabus is changing or takes place after every 10 years. Okay. So approaches for the nursing quality assurance. So what you will do to assess the college, like students, always they will be in dilemma while selecting a college. So generally people say ki it is nearby me, near to my home, so I will select this college. But the student who is very intelligent and sharp, so who will be thinking about the future, not about the comfort. So when we wanted to be in a comfort zone, always will be in a comfort only. So there will be comfort, there is no classes, no college, nothing will be there. So that comfort will be always. So when you will think about the comfort, there won't be the quality. So quality comes when you take efforts. So it comes with the effort. So same thing, like when we are selecting a college, what are the things we are going to see in a college? It should be a best college. We should provide a good clinical facilities. We should give a good educations, imparting a good educations with the quality teachers. So these are the things how we'll see. So nowadays so many things are there. Like what they do to see the ranking of the colleges. Some of the things which is given on the website also, like marketing era is there. But when we goes to the particular organizations, when we'll get a feedback from our students, from relatives, from the friends, then we comes to know what kind of college it is. So always when we are selecting a college, so we'll see the quality of education in the college, quality of the teachers of the college. So here, some of the approaches exist in quality assurance. So each and every college will be accredited by somewhat. Some of the agencies like a NEC, ISO is there. So fortunately, I have been as an internal auditor for ISO, International Standard of Organization. So since 2009, I am a management representative for ISO as an internal auditor in our society. So where we have learned how the approaches will take place to improve the quality. So definitely when we see the ISO, so what they do, it is a very simple things that we are doing in our professional things. So there will be a quality manual where there will be a certain things or activities which will be followed by the organization will be there. At the same time, along with the quality manual, there will be a quality procedure book. Like where there is a standard like first, like what we do to provide academic activities. So what procedures we are following for that? That it will be there in the quality procedures. So when we follow certain things, in that condition it shows that how your organization is working. So that working will be assessed by some of the approaches in the organization. There it will be make confirm ki this organization how it is working. So on the basis of that working, then we select the college, like this is my category college and I will go to this college and I will pursue my education in this college and then we'll proceed for the admission and that process will be there. So for this categories, the approaches which exist for the quality assurance are, the first one is a general approach and then second one is a specific approach. So if we see the general approach which will in everyone, so when it comes to the education, what are the things we do for the educational, how you are going to assess the quality of the education, like many things come, like he has done from the institute which is recognized or it is accredited by some of the agencies, or whether it is from the organization where he is approved by some of the bodies, supreme bodies like Indian Nursing Council we say, Maharashtra Nursing Council we say, Maharashtra University of Health Sciences we say. And what we do for this, we are going to verify the things whether the person is correct or not, whether he has done from the correct organization or not. So for that there are the approaches are there in that general approach. There are 4 approaches of quality assurance we follows in a educational site where your educations where you have got your degrees will be assessed and will be confirmed like you are from the correct organization and you are eligible for it. So first one is credentialing. So it is a process where we are going to check out all the documents which you have received in your degrees, diplomas, masters, PhD, whether it is correct or not, whether it is from the right organizations, whether your organization is approved or not approved or affiliated from the body which is governing your organization. Then accreditations, already I told you. So whenever we are going to select a college, always we will see. Nowadays, NAC is compulsion for each and everyone. Every college, it will be in upcoming days or upcoming years, it will be compulsion to each and every organization to undergo NAC accreditations. So NAC accreditation, it shows how your organization is working. So same like this here, the accreditation is there. It is a process of officially recognizing university or institute. So if a person is coming out from like this organization, definitely we can say the persons will be a good. Means he is from the right organizations and he is coming to our organization, means he is fully confirmed that he is from the quality organizations and he will be able to deliver a quality education to the student. Then certification. Definitely certifications. So each and every persons when they are passing out or they are completing their course, certificate will be there, and it is a process of providing individual with an official document attesting to a status or level of achievement. So when they will be completing their degrees or diploma, they will be getting a certificates. So certification is very, very important to get a post or positions in academic organizations. And definitely it is a great thing, license. Once we will be registered, we will be relief. And we will be relieved from the stress. Finally, I am a registered nurse. And then we will write RN, registered nurse with the numbers of the particular council. Then you are eligible to work. So license is very, very important, which shows the quality, means you have done your educations and you are certified for this, and after that you got the license and you are ready to work in the organizations and you are fully occupied with your educations and you are ready to deliver your services to the customer. Then there is a specific approach. Okay, so general approach we have seen, there are the certificate, accreditations are required. So like here there is a specific approach, peer reviews. Peer reviews means the review which will be given by your colleague. When you will be working in an organization, so management has the authority to ask, and each and every management do this work. There was some specific, like बोलते हैं ना अपन जासूस, खबरी. So like that each and every organization has, and this is a beautiful thing of organizations, where they are observing the persons without knowing their activities and all. He himself don't know who is looking his activities which he is rendering to the stakeholders. So that is a beautiful thing I can say. I like this one. Like each and every individual should know that someone is observing. If someone is observing means will be a more and more like our eyes will be like this. Someone is observing. I have to give 100%. So like that each and everyone will try to give 100% when they are thinking that someone is observing us. So your peer reviews, so it will be taken by your friends, those who are working along with you. So they will give the informations about your workings, about your styles, means how you are working, whether you are satisfying, whether you are performing well or not, or according to the satisfaction of the society or according to the satisfaction of your organizations where you are rendering your services to the stakeholders. Then evaluation, definitely, this is a very, very important thing in evaluation. And since first day when we admit to the nursing profession, evaluation comes all together. Like wherever you go, evaluation will follow you. So many evaluation formats, evaluations, teacher evaluations, clinical instructor, then so many things will be there related to evaluation, and it is the best mechanism where we'll be able to know what we have done. Why we do this evaluation? There is a various kind of evaluations are available, scales are available, so many things which we do according to our comfort zone. So in that evaluation which gives like whatever the services we have rendered, whether it is satisfying. If it is not satisfying, then again our circle will goes and like will provide again services to the persons, and then fully when patients satisfy, then we can say quality is delivered to the patient. And then we'll satisfy, and then we'll say that I have given justice to my services or my quality I have delivered to the patient, and patient will say, yeah, I am comfortable, I got the things, or student will say, yeah, I got a good educations from my organization, I am fully satisfied and I can do. So like that, the evaluations will take place. See, this is the quality assurance process. So like each and every organizations always they follow the procedure which is there in their college. So like each and every activity there is a process and procedures to assess the things which is there in the particular organization. Like many organizations or some of the organization, everywhere we follow some of the rules and regulations and some of the steps, how should be the services assessed. Assessment part comes, so how the quality goes, like same thing I told you in the ISO, when the accreditations committee comes, what they see, means what is the activity and what is the process for that. Like when we see the examinations, what do we do for it? Before the examinations, there will be examination committee, examination coordinator. They will discuss along with all the HODs, with the principals, then decide the meetings. And in the meetings, before the 45 days, they will prepare the timetables, and then they will inform to the students. And then there will be the next process of paper preparations. Then papers will be there, then moderations, then second moderations. Then finally, this will be there. And then there will be the arrangement of the examination halls, then supervisors, everything. This is the process which will be there in an examination. So same like this, each and every activity there is a procedure and which will be followed by a system. If you follow the system, quality comes. If you are away from the system, we cannot expect the quality will be delivered by the person. So always be in a system. So when you will follow the system's quality. So here, establishment of standard, definitely. So whatever the services we are going to give to the persons or stakeholders, the standards, every time we have to prepare. This is the standard which will be followed, and then identify the information relevant to the standard. So whatever the standard which you have formulated, so what will be the information required for this? Means what we can do for this following standard. So second will be there. Then determine the ways to collect the information. So this information from where we can collect. So many information will be collected regarding the standard, and then collect and analyze the information. That is again very, very important things. I can say it is a planning, selecting from the alternatives. Many things will be available related to one standard. If you will search a Google, if you will search one point, there will be many things will comes on your ways for your answer. So same thing like this here. If we are making a standard of things, many things will be there for this, the informations, like this is the way. where you can give. That is another way. So from there, selecting from the alternatives, it is your capacity of your mind. So which quality will be best for this? So like here we have to collect and analyze the information, and which will be best will be selected for your standard. So that is the standard. Always when we say the standard means it is the highest and highest quality, which will give a satisfaction. Like yeah, it is a correct and मुझे अच्छी चीज़ मिली है. I am satisfied with this. So compare the collected information with the established standard, then make a judgment about the quality, and then provide information and if necessary take corrective actions. And finally last and step where we are going to re-evaluate whether whatever the standard is made by us, it is satisfying the customers, it is satisfying the stakeholders. Then if it is satisfying, then we confirm. If it is not satisfying, then again our cycle goes, refining and refining and refining, where whatever the information are collected, we'll select the best and we'll do again and again. So this will be the process in selecting a quality assurance in a field of nursing educations, where we can correlate in the clinical practices. So there are the factors influencing quality assurance. There are many factors are there which will be obstacles to your services. Like here in nursing educations, we are very well aware what are the obstacles are there which will be keeping away from the quality educations to the student. So many things we are very well aware. So here some of lack of resources, definitely. There is no quality teachers are available to render the services to the students. Or whatever the resources are available, they are not taking effort to give a quality education to the students. That is a prime and important factors in quality assurance in nursing educations, and definitely we are suffering. So be a quality persons. Always I used to tell, be a quality person from since beginning. So when you follow the quality, automatically everything will go in your ways to get a quality. So lack of resources, then personal problems, lack of trained, skilled and motivated employees. So employees are there, but they are not very well trained. That's why staff training academy, that is a concept in the educational organizations. Staff training academy, if you will see the NEC accreditation also, it is compulsion for the staff development. So for this we do staff training. So here in our society we have a staff training academy. So they refine all the newly teachers appointed or the teachers, those who are already appointed, for them they are conducting many seminars, many conferences. That is a free of cost, and newly appointed there is an induction program. So that is must, and it should be there for the making a confident teachers. So like that, here this is the difficulty, because whatever the resources is available, but they are not enough to deliver the services to the society or to the stakeholders which is required to be a quality person. Then unreasonable expectations of patients and their demands, absence of well-informed populace and absence of accreditations law. So these are the common difficulties which we are facing to delivering a quality educations or quality assurance to the students. Now this is a very, very important model which is given by the American Nursing Association, where how we can proceed for the quality assurance to the stakeholders, and for this what we do. So it follows one cycle. So in that cycle, same like what we do and how we follow the procedure for doing any activities in the organization. So the ANA has developed quality assurance model in 1977, which has widespread applicability in any healthcare settings and can be used as a guide to implement quality assurance program. So mostly in our colleges and any organizations, it is mostly followed. Quality assurance model means what we can do to develop a quality of education in a organization. So see, it is a very simple model which is given by ANA. So here when we think about this, identify values. Identify values means we have to see the what we are going to make a change, what activities we are going to do. So when we think about here the stakeholders, we are there in the education side. We have to see the stakeholders' demand, what we can do for them for the better future and better educations. And then at the same time, so when we look after for the patients in the clinical side, always we have to think about the philosophy regarding the patient conditions. Means how the patient is, what is the expectations of the patient, what we can do for the quality. So that things will be there in the clinical side, whereas in the education side, what is the demand of students? What they require to refine them? What are the things required to make a good students or good learners? So for that we have another mechanism, mentor, mentee, mentorship. So where the mentor will be there and he will look after for the students, where the slow learner and fast learner, everyone will be there. So we are refining the students. So same like this here, identify values means what are the things on that we are going to work, which will take either from side, whether it is a student or patient. So both the side we takes and will confirm what are the things where the quality is required. So that philosophies and that points we are going to take under the identify values, then identify standard and criteria. So whatever the activities which you have selected, for this we have to collect the standards, means what will be good for this and how we can deliver good things to the patients or to the student. Then secure measurement. So whatever the standard you have taken, so for the standard what we do in our research, many things we see measurement, we do tools, each and everything. So we'll measure here. So whatever the standards we have taken, whether it is measured or not, whether it is confirmed or not. So for this, measurement is required to confirm the standard. Then make measurement, then these measurements will be taken by this. And then identify course of action. So for this measurement, what we can do? What will be the course of action? Means how it will be, what will be the course of delivering? What will be the mode of delivering the services to the persons? And then when we have identified the course of action, means this will be delivered to the student, this will be delivered to the patients, and then we'll make confirm, and then the course of actions will be identified and selecting from the alternatives, and then choose actions. So what actions will be required to deliver the things? So in the education side, there are various ways are available to deliver the services to the students, and then after that take actions. So it will be implemented to the persons, and then last and final, when we deliver the actions, the evaluation is required. The patient satisfaction, the stakeholder satisfaction, which is required. If the student are satisfied, means we have done our job. And then automatically we'll say, Shabbas, you have done well things. Good things you have done, your students are satisfied, and fully will be confident like, yeah, whatever the services I have rendered to the patient or to the students, and it is fully used and patient is satisfied. So patient satisfaction, stakeholder satisfaction is a quality assurance where everyone will be happy after the services which will be given to the stakeholders. Stopped. It's not working. So now we'll see the clinical practice guidelines. So when we think about the practical guidelines, always one thing comes in our mind. Whenever we are delivering any kind of procedures to the patients, what we follow? Procedures. So in the procedures, always there will be guidelines, the rationales will be there. Like when we wanted to give a suctioning care to the patients, we knows aseptic technique is must, how to clear the airways, how to use the catheters. So everything in a systematic way, there is a guidelines. So when we are there in the clinical side, always there is a guidelines which will be followed. When we are there in the casualty, when we are there with the defib, then whatever the guidelines are there which we are following. And sometimes somewhere there will be SOPs, standard operating procedures. So what is it? These are the clinical guidelines which will be followed by you. And when we follow these guidelines, we will be in a correct way, and the correct and desired result will be there. So these results, for that there is a clinical guidelines, and each and every sectors when they are dealing with the healthcare will be following the clinical guidelines. And these clinical guidelines are the safeguard for the health workers. So these clinical guidelines it is a standard which comes after so many research, and it is based on the evidence-based practice. And nursing, always we say, it is evidence-based practice, because when we deliver the services, the desired result comes, and with this desired result, we'll confirm that whatever the services are, it gives 100% surety. So here in this clinical guidelines, always wherever you are there, please follow the standard guidelines. You won't be in your different way. So when you will follow the guidelines, automatically some things will be there in your mind, and automatically will be follow the guidelines. Automatically one by one it will be there. If you make a habit of following the rules and regulations, then automatically you comes in an era where the system goes smoothly, and automatically in your mind it will be there. This is the first step, then automatically second step will be there. This is comes when you are there for the quality, and quality follows. Okay? So these are the guidelines. So wherever we are there in the clinical sectors, there are some of the SOPs will be there, some of the standard guidelines will be there, and always please try to follow the rules and regulations. When you will follow the rules and regulations, definitely there is a good things which will be followed by so many persons, and there will be a good things for your ways in your upcoming services or your in upcoming achievement. Everything will be helpful. So the American Academy of Family Physicians develops evidence-based clinical practice guidelines. So this is based on evidence-based, where the result is known after the services, and it comes after the refining research and research and research. So when we are 100% comfortable and confirm that this services is after the many activities, and this result is a desired result which is expected by you, then if it is desired, then automatically it will be followed. So same thing, the guidelines should be followed wherever we are there in the clinical settings. So clinical practice guidelines are a statement that include recommendations intended to optimize patient care. Recommended, how it will be recommended? Same thing, EBP, evidence-based practice, because it has suggest that this is the best thing. So it will give a desired result. So here, this is the recommendation by your EBP, evidence-based practice, which earlier you have done. It is comes after the refining and refining process. Then they are informed by a systematic review of evidence and an assessment of the benefits and harms of alternative care options. So definitely when we follow the guidelines, it will be preventing from the harm of the patient and harm to the service rendered or service providers. So always follow the rules and regulations which will be preventing from the harmness. Okay. So this is related to clinical guidelines. So always wherever the guidelines are provided as per your services, that is a standard, and which will be taken from the standard which has already worked, and it comes after the refining and refining and refining. So this is my request to each and everyone. Wherever you are there, please follow the quality. If quality is there, there is no need to search the job. So if you have a quality, automatically people will come to you. Please come to my organization and serve your services to my organizations. So when you will follow the quality, quality will follow you. Always this mantra to yours in your mind. Quality, when you will follow the quality, quality will follow you. Quality people will come to you. There will be a good contact and will be a good platform for the quality. So always follow the quality. Quality will follow you. And this is the last point about the quality assurance. You can say quality is never an accident. That's why quality ke liye kya karna? We have to be a cream. So cream will be. So each and every person has the same capacity and quality. But the thing is that we have to make use of your brain. And always I used to say to my student, brain को use करो, otherwise जंग लग जाएगा. और वो होता ही है. So always try to shine your brain. जितना brain चमकेगा उतना you will be a quality person. So always make use of your brain. And each and every person has the same capacity, same brain. किसी का different नहीं है. We have a two hemisphere. Same thing, each and everyone. So make use of your brain. Otherwise brain सो जाएगा तो nothing will be there. So make best choices for your brain. Give sharpness to your brain. then automatically your quality will shine one day, definitely. So that quality is never an accident, it is always the result of intelligent effort. So definitely intelligence brings quality in you. So keep going with the intelligence, it will bring the quality within you. And definitely each and every person has a quality, same quality, but make use of the resources which is available on your ways. Make use of your resources which is there. So that will brings the quality in you. So whatever the circumstances are there in your sectors, whether you are there in the college or are in the clinicals, whatever the resources, make use of it. Don't be shy. मैं पूछूंगा पीयूष सर को तो मुझे डांटेंगे. Nobody is there to scold you. They will help you. When you will take interest, he will take more than you. And definitely ये चीजें होती है. So when student comes to me, I will take a more effort. So when student says, Hussain sir, आपने ये बहुत अच्छा class लिया, then I will make use of my all other resources and I will be more and more confident to deliver the services to the students. And make use of the resources and keep in mind whatever the circumstances are there, make use at the correct time, at the correct job, definitely the quality will comes to you. Okay? So be quality and brings the quality wherever you are there. And please don't say this is not my work. Mostly I have seen nowadays the students, the teachers, they say, why I have to do? I am getting only this much salary. But you are getting a salary. Why you join this organization? You are getting the salary. Some are telling, नहीं मेरे को उतना नहीं मिलता है जितना मुझे expected है. So go there where expectation is fulfilled from the organization. So wherever you are there, give your 100%. If you are giving your 100%, definitely 100% will be there. So make use of all the circumstances, whether you are satisfied or not. So make a habit of doing good things. So quality always will be followed when you will follow the quality. So this is regarding the quality assurance, and I hope each and everyone will try to give a best services to the best citizens of India and be a good citizen of India. Thank you so much. If you have any difficulties, please you can ask. And it is a very, very important things of era. So be a quality person. So if any questions, because it is a very common topic and for enjoyed, I think, because it is from the MSc students, quality assurance, and it is much needed, because this is the era of corporate where each and every individual are very smart. Patients are very smart. Before delivering your services, patient खुद बोलेगा बाबा ये तो medicine ऐसी है, अरे ये तो half dose है, and this is happening. This is happening because our students are busy with the social sites, Facebook, WhatsApp. They are not coming out from this. So patients, because they are fearful, means what will be my next? They don't know. So they will be very eager to know about their conditions. So they will see each and everything and they will become half doctor. So it is a half doctor only because we cannot rely the information which is available on the Google. So patients, they are smart. So for the smartness, quality is required. So when you will deliver the quality, patient will satisfy. Otherwise, patient himself will tell you, please go and study. And in many hospitals, patients are not allowing students, mostly in a corporate hospitals, because they don't have a confidence on you. So be a confident, be a quality person, so stakeholders can rely on you. So this is from my side, and thank you so much, especially Godavari organizations, Piyush sir, Kole sir, has given a beautiful opportunity. So I met my old friends from all over India. So we are having a good sectors for the education's platform. So where we are doing many activities with the many services which is there on the way of nursing education. So we are also learning. We are also a learner. So always be a learner. Don't be shy in learning. So when you have a learning, keep going on. Refine yourself. Be a master of your services, because we are there from the professions to. So we have to be a master of our profession, because I am a nurse, so I have to be a comfort nurse or complete nurse. Complete nurse means good knowledge, good skills, who can satisfy the customer. So this is about quality assurance, and thank you so much.
Thank you, sir. Thank you, participant, for patient listening. I would like to extend my heartfelt thank you to Dr. Mohammad Hussain sir for his insightful presentation on quality assurance in nursing education His expertise and perspective have been valuable, and I am sure we all live here with a deeper understanding of how to enhance our quality of nursing education. I also want to thank each of you for your participation and engagement throughout the session. Let's continue to strive for excellence in nursing education and practices. Thank you once again. Have a wonderful day. Thank you.
Thank you, sir. Beautiful quote made by sir. Quality is never an accident. It is always the result of intelligent effort by John Ruskin. So it was really an informative session, sir. Sir has focused on each and every aspects of quality education to improve the clinical practice. Thank you so much, sir. Now I request Professor Piyush Wag, sir, HOD of Department of Nursing Foundation, to present the certificate and memento as a token of love and gratitude to Dr. Muhammad Hussain, sir, Vice Principal of Gokhale Educational Society. Thank you, sir. Our next session is on interdisciplinary approaches in nursing practices by Dr. Nesa Satya, Principal cum Professor and HOD of Pediatric Nursing Department in Apollo College of Nursing, Chennai. The moderator for the session is Dr. Priyadarshini Moon, HOD of Nursing Research Department. I request Madam to please come forward. Over to you, ma'am.
Thank you, Nimi Madam. Good morning to everyone and welcome to this exciting session of second day of National Conference 2K24. My name is Dr. Priyadarshini Moon and it is a pleasure to serve as a moderator today. The Florence Nightingale once said, nursing is an art and if it is to be made an art, it requires as an exclusive a devotions. As a hard a preparation as any painter's or sculptor's work. Our speaker today, Dr. Nesa Satya Sachi, embodies that devotion not only as a skilled clinician, but also as an advocate for interdisciplinary collaboration in healthcare. We are about to hear from an esteemed professional whose the contribution to nursing and midwifery have significantly impacted the healthcare landscape. It is my honor to introduce our speakers, Dr. Nesa Satya Sachi, Principal of Apollo College of Nursing, Chennai, a distinguished registered nurse and registered midwife. Welcome, ma'am. Ma'am has completed Doctor of Philosophy, Tamil Nadu MGR University in Chennai. Master has completed Master of Science in Psychology, Tamil Nadu, Physical Education and Sports University, Chennai. Master of Science in Nursing, Child Health Nursing in Christian Medical College and Hospital in Vellore. Bachelor of Science in Nursing, Christian Medical College and Hospital, Vellore, the Tamil Nadu or MGR Medical University, Chennai. Madam having total year of experience 20 years 9 months, total year of teaching experience 15 years 3 months. Madam has a co-author a book exam primer for BSc Nursing third year students. Madam has published more than 16 articles in national and international journals. Madam as an organizing secretary for more than 20 national and international conferences and presented paper as an invited speaker in such a conferences. Madam has presented more than 80 papers in national and international conferences. Madam, as a recognized university guide for PhD research scholars, executive editor of Journal of Pediatric Nursing, published by the Tamil Nadu Nurses and Midwives Council till date. Madam has a contributor of the editor of Journals of Pediatric Nursing, published by the Tamil Nadu Nurses and Midwives Council from 2018 to 22, or article and journals publications. Madam worked as a practical examiner and theory evaluator for PG and UG in nursing by Rajiv Gandhi University of Health Sciences, Karnataka. Madam having the award and Sukmar Prize for the best student in child health nursing during MSc Nursing for academic year 2003 and 2004 in Christian Medical College, Vellore. Madam has awarded Achama J. Jacko Prize for the best clinician student in MSc Nursing for academic year 2003 and 2004 in Christian Medical College, Vellore. Madam got the best teacher award by Apollo College of Nursing in the year 2011. Madam has the best academician award by Apollo College of Nursing in the year 2019. Madam having outstanding faculty mentor award 2020, most socially responsible staff award, Bhumi Campus Award 2021, eminent leaders in nursing education 2021. The Tamil Nadu Nurses and Midwives Council, Chennai Certificate of Registration of Nurses. Madam having Tamil Nadu Nurses Midwife Council, Chennai certification. Madam has a member of TNA and member of Christian Medical Association of India and Nurses Legue. So this is all about the madam. I'm welcome to the madam for this flora of session. Over to you, ma'am. Welcome, ma'am. Thank you.
Madam, it is working, but for online participant, it is more usable if you will use this. Clearly,
Namaste and good morning to each and everyone present here, and thank you, ma'am, for those kind words of introduction. And I thank Mr. Piyush and the principal and management of Godavari College of Nursing. And I thank my friend Ms. Jamuna who introduced me to Mr. Piyush. So sir has beautifully said, if you maintain quality, the world will follow you. So I believe that something that I have taken in my life. Being one of the youngest person in Apollo College of Nursing, I got this privilege of becoming the principal because of the quality. I was very particular to maintain the quality, so that is why I have taken up this responsibility at a very young age. So I was thinking, how come being in nursing education, this topic of quality interdisciplinary approach in clinical practice has been assigned to me. So I have left clinical practice in 2010, but still I felt that in our country, a place where interdisciplinary approach is maintained is CMC Vellore, where I was trained. Long back, 25 years back when I studied there, that time itself they started practicing this interdisciplinary approach. So I will share some personal experiences, what I have learned, and also some models that people are following, and the examples what we are following in Apollo hospitals is what I'll be sharing. I'll keep it very brief. I know that you all are master level students and you enjoy brief notes, because we are in the world of watching reels. We don't like somebody speaking for more than 2 to 3 minutes, but I will speak very short. So I bring greetings to you from Apollo College of Nursing, Chennai. So among the 13 colleges that Apollo Hospitals has across India and Bhutan, this is the first institution which was started. I would like to start with a quote. Together everyone achieves more. So many times we believe that individually we can do so many things, we can't do anything. Only as a team we can do more. So in nursing practice or in the clinical area, it is important or imperative for us to collaborate with number of disciplines. So we collaborate with multiple expertise like medical people, social workers, physiotherapists, pharmacists, psychologists, and now you have so many disciplines in clinical area with whom we collaborate. So to all this, who is the center person or who is the heart of healthcare? It is a nurse. It is a nurse who collaborates everybody and keeps them together. So it is very important for us to know our role in clinical area. You prefer me to stand here or walk? I love to walk around, but because it's a hybrid mode and there are online participants, they won't be able to view. So that's why I'm standing in one place. If you take the history, how this interdisciplinary practice started, in the beginning, if you see, earliest moment when during the Crimean War, when nursing actually started, that time itself it was formed that a nurse and a doctor will work side by side. Then later in the 20th century, when nursing education came into place, the doctors and the other healthcare professionals found that the nurse has enough knowledge to share with other professions. She was able to tell what has to be done to other professionals also. Now, in the 21st century, we have more of patient-centered models, we have more of managed care, and number of models which has come where nurses play a very important role along with others. So today we are in this world, we are confronting lot of social, economic and environmental challenges. I mentioned the challenges down. What are the challenges? The rapid technological advancement, we have globalization, that is now we are welcoming patients from other countries to our country. Population is on the rise. There's a rise in aging population. There is longer life expectation and there are number of chronic diseases. Recently, we were celebrating the diabetes mellitus day also. So we found that India is the capital for diabetes mellitus. That doctor was telling like 1 in 10 in India, 1 in 10 person is either having diabetes or is in pre-diabetic phase. So increasing nursing, increasing specialization, like when we were students, there were very minimum specialities available in any field, like medical or any field. But today, if you see each and everyone, there is more and more specializations available. So research is showing that when we have interdisciplinary approach while caring for our patients, it enhances the effectiveness. How you deliver the care is more effective. It boosts your work efficiency and strengthens professional relationships among medical staff. So, I would like to tell an example. As a very, very small, timid girl, when I joined for nursing, when I was in first year, I remember one doctor asking me to get a chart from that side. So, sincerely, I ran to get the chart. While I was my teacher was going on watching me getting the chart. While I was about to hand over the chart to the doctor, she said, no, replace the chart. And she taught me a very important lesson. She told that the doctor has hands and legs to go and take the chart. Not a nurse's duty. You are not a maid in front of the doctor. Okay? So that showed me that day that we are working along with doctors or any medical field. We are not under anybody. So today we have to train our students in such a way that they become assertive. I think you all know the difference between assertiveness and arrogance. Assertiveness is standing for your rights in a humble way, telling what is right and why it can't be done. So interprofessional, interdisciplinary collaboration, it is like you can bring the confluence of expertise. So today we say that in nursing also we have so many specialities. We have MSc nursing, we have post-diploma courses in number of specialities. But are our nurses showing that skill? Is there any difference that they make in the clinical area when they say that I have completed my master's, or I have done my specialization, or I have done my nursing practice course? What is the difference? That difference shows so that we will be involved in the interdisciplinary care. And earlier days, if you look, in a hospital, the patient was in the center. There were so many people providing services. Each one was providing services on their own. There was no relationship between the different professions. That is breaking down the silos. What is the silos? We are working independently. Each one is doing what we want. That will not bring about a proper outcome. So that is how this concept of interdisciplinary approach came. Then data integration and interpretation, like this concept is recently it is talked about much because we have so much of data about patient. Now each one cannot interpret in their own way. How commonly we can use the data to improve the practice. Then educational initiatives, then navigating technological advancements. I don't know how many of you are aware, nowadays engineering and other departments are collaborating with nurses, with medical field to bring about lot of technological advancement. Like now we are having a paperless charting system in the hospital. That is, nurses are documenting it directly into the computers. So what are the advantages? Anybody can view the data. A doctor sitting in the OPD can view the data about his patient in the clinical ward, what is happening, what is the nurses finding, what is the lab test that has come, everything can be viewed immediately. Then ethical and legal consideration and challenges we will see in the next few slides. So from this working as a silo, then we moved to a phase where each profession was, each skill was different, but we were doing it on the same person. So different with shared approach was the next thing that happened. Now this new concept is interprofessional collaboration. When this came into existence, there's a collaboration. That is, first of all, you form a interprofessional team. So I'll be talking in the last slide, like how it is followed in Apollo. We have a concept called as ward. There is an expansion for ward, which I will tell, where they are saying each ward itself, each ward is considered to be an independent unit, where an interprofessional team is formed. Their roles are clearly, there is a collaboration, there is to support them. So what is the outcome? The outcome we see is the consumers, that is the patients, are very satisfied. There's a healthy lifestyle, they get discharged very early. And what is the advantage for us as healthcare workers? We have a job satisfaction, there's a professional growth. When there is job satisfaction, there is more of retention. Now, what are the foundational principles or concepts of interdisciplinary? First one is team. So, you know that here team means not only nurses, it is teamwork of every discipline. Even a housekeeping staff is part of your team. Okay, only in our country we label people based on their educational status, socio-economic status, we label them. But in other countries, each one is very proud to do their responsibility, whatever is assigned to them. End of the day, everybody goes together. I had the opportunity of working in Ireland for 2 years. So during that time, a housekeeping staff will do his work during duty time. But end of the day, you will find the doctor and the housekeeping staff traveling together in the car. Or during break, you will find them having a tea together, even discussing about some patient issues. That is, everybody is considered to be part of the team. Next important thing we lack or we need to train ourselves is communication. So what is communication? we know that it is sharing of ideas or thoughts between two people or more people. So that skill also, or how we develop, we will see very soon. Then respecting each one for their role. Few years back, the housekeeping staff in the hospital, they went on a strike. That is when the hospital realized the importance of the staff. No one else could replace them and take up the role. Like even one person, when they miss from their clinical area or they are not there, their role remains empty. So we need to have mutual respect for each other. So to make this interdisciplinary approach very successful, first thing is you need to give a role clarity. Like I should not cross my role. So we all know that as a nurse, I am expected to provide care to the patient. Suppose a patient comes and asks to me about the treatment protocol or the prognosis or what will happen in 10 days. Am I supposed to tell that? Should I tell or I should not tell? I am not supposed to discuss about the condition of the patient. That remains with the doctor's role. So each person is assigned a role and responsibility. So without ambiguity, I cannot say that I am also qualified. I am a master level, specially trained in child health nursing. So I can extend my knowledge. I know that a child getting seizure, less than 5 years, it's febrile seizure, I need not worry. I just have to teach the parents about managing temperature. I cannot do. That is the role of the doctor. So, but I can tell when seizures happen, how they have to take care. What first aid they have to give at home, I can tell. So, role clarity is very, very important. Second is, you need to have trust and confidence in yourself. Many times we think we underestimate our power or ability. So do you all have a note and a pencil, pen or pencil in your hand? Now do you have? No? Yes? Can you show that? Yeah. So a very small exercise to know your trust or what is your ability. If I say that, if I ask a question, how many star, you know, a small LKG or pre-KG student, when they do something good in school, they get a star, no, in their hand. How many stars you can draw in 30 seconds? Ma'am, if I ask you, what will you say? How many stars you will be able to draw? Tell one number. Huh? 10 or 20. Okay, so you all decide a number in your heart. No need to tell me. Okay, so ma'am has told 10 or 20. Now I'll give you 30 seconds. You draw a star in the note. Don't start now. When I say start only, you have to start. Don't look at the size. Don't look at the design. Don't think that it has to be perfect. Just start drawing very fast. Okay, start. Stop. Ma'am, can you count? $21 stars. So she was expecting to draw 10, but she could do 21. So that is how with most of the things in life we think that we can't do. We have the ability to do more than what we think we can do. Okay, so always trust yourself and also you trust your team members. Don't tell words like, she can never do anything. Don't give her this responsibility. It will be a failure. Then overcoming adversity. There will always be problems when you do certain things, but you have to somehow as a team, you have to overcome. So always I remember Abdul Kalam, the first time when he wanted to launch the rocket, he failed. His team failed. So everybody was looking at him, asking for an explanation why it happened. He never blamed anybody. Though he was just the boss, others only were doing it. He took all the blame on himself. He said that it is my fault. that if I would have done this properly, I would have. That is the important thing as a leader or a group head that you can do, is taking the blame that I should have done that better. Then collective leadership, and last one is personal difference. So it is very, yesterday also, last night when everybody was talking together during dinner, they were saying like managing people is very different because difficult. Each one is very different. It is not how you think. Each one, you may expect that they will react in this way, but you will find them reacting in entirely a different way. So though we have personal differences in a team, we have to manage. We have to overcome all personal difference. Our only goal is to bring positive outcome in the patient. Now, there are 4 competencies they are telling. The first one is values and ethics for interprofessional practice. So, first is again and again they are talking about having work ethics, how to have mutual respect for each other. In a team when we work, sometimes we may have people from various culture. We call that as cultural diversity. But today ANA is giving another definition. Don't have cultural diversity, have culture humility. So what is this culture humility? It is a humble and respectful attitude toward individuals of other cultures. Many times we feel this is my place. How can somebody from another state or another community come and teach me or tell me something? It's not right. If you want to progress, if you want to come up, you have to have cultural humility. It is a humble attitude to accept that this culture also has some positive things to teach us. So in our team, the lowest person may give some idea, or the youngest new joinee may give some idea. It is not that the person doesn't know anything. They would have worked somewhere, they would have studied somewhere. There is good in everything. So we should be ready to learn that. Next is roles and responsibility. So for this roles and responsibility, I already explained to you what are roles and responsibilities of healthcare professionals. For each healthcare professional, you need to assign roles and responsibility, and you should see that you are staying within that role, not extending your role to the next person. Then interprofessional communication. We communicate with the patients, we communicate with the team members, we communicate with families, we communicate with so many other people in our daily life. So I was telling that we will learn little more about communication. So in communication, these are the tools we are following. The first one is ISBAR. ISBAR is what we are following in Apollo hospitals. What is ISBAR is, I stands for introduction, S stands for situation, B stands for background, A stands for assessment, R stands for recommendation, and the next R stands for repeat back. So what is this introduction stands for? So when you are going to a patient or to a team members, first of all you have to introduce yourself, introduction of your name and the purpose of why you have come. Second is the situation. Next is you have to tell where the client is located and what is the reason why you are calling. For example, the vital signs is dropping. Vital signs is not what you expected. Okay, or the status of the patient is deteriorating. Okay, that is the situation you are going to tell. Third is you are telling the background. So without telling anything, any history about the client, if you just tell vitals are deteriorating, the other person will not understand what it is. So you have to tell with what problem this patient was admitted and what is the current progress. That is what situation you are telling. Then the person you are telling, the team member is not here in front of you. So you are only physically present. You have to assess the patient and tell your assessment finding. Okay, so that is the A, assessment. And next is recommendation. Recommendation, what it can be, you can decide and tell, please do a lab investigation, or please recheck the vitals using a particular device, or you can tell some advice you are giving. You are giving a recommendation or you are getting a recommendation from the other end. You have to repeat back. Okay? Whatever they said, you need to tell again. Why you are telling again? For the other person to know whether you got the right message. Okay, so you have to tell again. So this is ISBAR, which is a common technique which is followed now, not only in Apollo hospitals, I think many are following that. We also, our MSc students, they did a study and they found it to be very, very effective in communicating the right things between patients and healthcare members and within team members also. The next is hands-off report. Hands-off report is when a person is telling something about a patient to maintain the continuity of care. We are having day and night report. No, that is called as hands-off report. Then we have closed loop communication. Closed loop communication stands for, like an emergency, a patient has come, you received a particular order, and with that it is over. You cannot continue that communication for long. For example, you are seeing a patient in emergency, you are getting an order from the doctor, administer injection Lasix 10 milligram IV stat. That's an order. Then you administer the IV and you report back to the doctor saying, I have injection Lasix 10 milligram IV. That's all. With that it is over. This communication cannot be continued. He said over phone to administer Lasix, I cannot be continuing that OD or BD. It is just when a life-threatening situation is there and the person is not physically present, you are given an order. With that it is completed. That is called as communication. Next we have one more method called as IPASS. IPASS stands for, I stands for illness severity, P stands for patient summary, A stands for action, S stands for situation awareness, and S stands for synthesis by the receiver. Synthesis by the receiver is what action the receiver has told. So all these mnemonics are self-explanatory. So first one is illness severity, patient summary, action list, situation awareness, and synthesis by the receiver. Now, we have seen 3 skills out of the 4. What was the first one? What was the first one? Values. We saw that values is the first one. Second is assigning roles and responsibilities for each team member. And third one is communication. Now, the fourth one is very important. That's why I was recapitulating the first 3. Fourth one is team and teamwork. Okay, so a new technique has come. Okay, so team and teamwork is something very, very important. We will see how we are going to do that. So this AMA, again Americans, they have a new system called as teams steps, okay? Team steps. So they are saying what is the qualities of a successful team. First is promote a respectful atmosphere. We need to respect each other. We cannot allow anybody to bully us saying you are only a nurse. Sometimes even when doctors come to take certain classes like anatomy, physiology, what do they tell? For nursing students, this much is enough. All these things are not needed for you. Yes, do they say such words? So when they say like that, what happens to the students? Their brain stops listening anything. Okay, they get offended. But they may not tell it outside, but they feel very hurt. So I don't know what is the practice here. In my college, we have faculty sitting in the doctor's classes. So when anybody tells like that, after the class they are called and they are said that, when you come for taking the class itself, you come prepared to take whatever is necessary for nursing students. No need to discuss that in front of the students. I know that certain things are not needed for nurses. It will be too much. We'll be wasting our time. But don't tell such sentences in front of the students. So it is not that we can say, they are doctors, we will leave them, they will change. Not like that. We are worried about the 100 students who are getting affected because of that one word. Next is define clear roles and responsibilities. Regularly share information. You have to routinely share information. So for that, we have something called as a huddle meeting. Huddle meeting is morning as soon as they come, all the team members gather around and they have a meeting. The team I am talking, it is the doctors, it is the housekeeping, dietitian, pharmacist, radiologist, everybody together, nurse, everybody together, they have a team. They talk about what information they have about a particular patient. Encourage open communication. Okay, that is, it can be right or wrong. There is no right or wrong answer. We should encourage communication even from our students. When students ask some questions, what do we tell? I don't have time. Go and refer. These are things we tell. We need to encourage them to ask questions so that, as Hussain sir was saying, that will motivate us to learn also. When we don't know, it is not wrong to tell in front of the student, sorry, I don't know, I'll refer and come and tell you tomorrow. That makes the student to develop a trust with you. We are not superhumans to know everybody. Even a doctor, they go refer every day and only come and practice. It is not that everything they have in their mind. So we can always encourage learning, and daily we can encourage learning, encourage open communication, implement a culture of safety. What is this culture of safety? The team members should be aware that whatever I tell, that information is going to be maintained confidential. Nobody is going to go out and tell, Ayo, you know, today in the meeting, in the huddle meeting, this girl was talking like this. She didn't know anything. A simple investigation also, she did not know. Nobody is going to tell like that. So confidentiality is going to be maintained. Provide clear directions, and when success happens, you tell, it is not me, it is my team that has succeeded. It is not I did it alone. It doesn't end there. You have to balance between the team members, acknowledge and manage conflict, which is very, very common, and enforce accountability. It is not only the team head is accountable. Everybody in the team is accountable for what is happening to their patients, and communicate the decision-making process and facilitate access to needed resources, and evaluate the team's outcomes then and there. So this is about the team steps I was talking. This is a new concept which is added up for interdisciplinary or collaborative practice. So what are the four important things under this is, first is leadership, first is communication, leadership, situation monitoring, and mutual support. These are the core concepts of this team steps. So communication, I think we have seen plenty of things about communication. So I will start with leadership. Leadership is, what is leadership? A leader is a person who maximizes the skills of his team members. Okay? In management, we study leadership is a person who gets maximum results out of the humans, or he leads. So many definitions are there. But here in interprofessional collaboration, what is here leadership is meaning that they bring the maximum output out of the team members. Because as a team member or a team head or a leader, first they have to assess what skill each and everyone has. Yes? So, I think yesterday you would have met Jamuna Rani. Yes? So, Jamuna Rani was my team member. I was the head of the child health nursing department. I had 6 people working under me. So, all of us had almost joined at the same time in Apollo College of Nursing. I was having a hell lot of time managing how to, because any responsibility given to anybody, I was not getting the outcome. So, I had gone for a conference to my alma mater, that is CMC Vellore, where they taught me this leadership. They said that first of all, you assess the skills of each and every person who is working under you. That is when I assessed each one's talent. I found that Jamuna was very good at maintaining interpersonal relationship. She can talk to anybody, she can get any work done, she can represent to anybody. So I started giving responsibilities like getting permissions from government settings, going and meeting our medical superintendent, talking to nursing heads. So wherever she went, she was successful. And each person in my team had different ability. So when I started distributing the work like that, I found my department growing. I felt that I was giving better output than before, and I was not getting upset why I am not able to finish what principal is asking me. I am not able to finish. This is one leadership skill we all have to develop. Take some time to sit and analyze who are your team members and what are their abilities. So today, you know that simulation is something which is coming up in great heights. So we have a very, very beautiful simulation lab in Apollo hospitals. Within my campus, I have a simulation center which was built up spending nearly 10 crores with all higher end, high fidelity mannequins we have. So when this simulation center was set up, they first approached a college asking, you want to partner with us. That is, we want to include your faculty to train doctors, to train people from other professions, and also nurses. Are you ready? I know that it's going to be difficult because my faculty have to manage the classes here, the clinical responsibilities, but also take up this new role. But I felt that it is very important that they grow in their profession. I said yes. So today I can proudly say that 36 of my faculty are trained